Why do I share Arlena's story? Because I don't want any other athlete or any other person to suffer in silence. I want to tell people of color the stigma that you're weak because you need mental health is not true. You're not the only person in the world suffering with anxiety, stress, and depression. And to please seek professional help.
This is not an easy thing to talk about, and we have 5 courageous parents here that have suffered tremendous loss here. But I said just before the break, what if I told you that you could detect risk in less than 5 minutes with 90% accuracy? We're talking about like suicide risk screening tools. One of these tools is the ASQ. This is a quick, effective tool developed for healthcare professionals to determine if further safety and mental health evaluations are needed. And if the answer is no to the first 4 questions, then no intervention is necessary. These are questions that seem real simplistic, but most kids tell you, I've never been asked this. The first question, in the past few weeks, have you wished you were dead? Yes or no? In the past few weeks, have you felt that you or your family would be better off if you were dead? In the past week, have you been having thoughts about killing yourself? It's pretty obvious. Have you ever tried to kill yourself? Now, if the patient answers yes to any of the questions 1 through 4, refuses to answer, that's considered to be a positive screen. And you ask question 5 to assess acuity. Are you having thoughts of killing yourself right now? And understand, this is, if it's something given to everybody, so it's not like, hey, you need to come with me and take this today, so they don't feel conspicuous. Everybody fills this out, and then it's reacted to privately and later. It has, in some of the studies, 97% accuracy in identifying these students, where they were just waiting for somebody to say something to them, hoping somebody would reach out to them, hoping somebody would intervene. And you think, well, these are questions with socially desirable answers. They have sense enough to say, oh, no, I'm fine. They don't want to say, I'm fine. If somebody will ask, the research tells us they will answer the question. Would that make a difference? Do you think it would have made a difference in y'all's situations?
We would have done anything had we known, had someone at school seen that and given us an indicator. We would have obviously jumped in first chance we had, but I think it would have been great to once a week.
It has to do with how the coaches set it up too.
Yeah.
If they, before it ever starts,
Yes.
before anybody has a chance of knowing that somebody might be dealing with this, if they let them know that, look, understand, we're concerned about you as a person, and we're going to be asking you questions throughout the season about your mental health and your physical health, and what it's going to tell us is what we need to work on. Nothing here is an exclusionary criteria. It just tells us what we need to put on our to-do list.
You're talking about the culture.
Exactly.
And the coaches and the athletic staff, they need to be trained on
Exactly.
what the suicide warning signs are, or if one of their athletes is in distress. And they need to know what is the next step for getting that person help.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.